कि सर पे टोपी है, मत कहो कि सर पे टोपी है, कहो सर पे हमारे ताज है, कहो सर पे हमारे ताज है, ये चमन हमारा अपना है। समाज है ये चमन हमारा अपना है, इस देश पे अपना राज है, मत कहो कि सर पे टोपी है, कहो सर पे हमारे ताज है, ये चमन हमारा अपना है।
Painless, so even though you do see a spot and you're like, well, I'm not feeling pain, I'm just going to leave it, definitely get it checked out, because a lot of times these areas can come with no pain, and that's when we still want to get things checked out. And I believe that is all I have to say. Yes, and when we want to examine, when you see something in the mouth, you can, the most I would make is 2 weeks. And if nothing happens in 2 weeks, it's still the same or it gets bigger, definitely go and see a dentist or even a physician. They can guide you in the right direction. And I will pass it on to Hermione.
Hi everyone, hope you all are doing good. So I'm going to discuss about the periodontal disease. So the smoking, you know that people smoke, right? So obviously that has a bad effect on oral health and overall health as well. So what happens when people smoke, they are unaware of diseases which are linked with the oral conditions. So with the smoking, we have bacteria in the mouth. So some bacteria are good bacteria, some are bad. So what happens with the smoking? Smoking kills the good bacteria in the mouth and it creates the bad bacteria. So what bad bacteria do? It makes our oral health bad. It affects the surrounding tissues like gums, like bones, around the tooth. So people in Canada, USA, there's a 90% of the people, population affected by periodontal disease. And the worst thing is that people who smoke, they think they don't know about the disease. Because what happens with the periodontal disease, when you smoke, your gums become more whiter, less bleeding because it's less vascularized. And what happens if there's no bleeding, people think they're healthy gums. But in other words, they're not healthy. They're chronic conditions which makes your gums more bad in condition and leads to periodontal disease. And later it leads to your tooth get mobile and your gums get more swollen and make it worse. So by keeping in mind, if people smoke, it's their choice, but always make sure to go to your regular dental visit and make sure about the periodontal disease. Because people with the diabetes as well, they are more prone to periodontal disease because of oral hygiene. Some people say we brush twice a day, but if we smoke 10 cigarettes, but we brush twice a day, that means we are healthy. That doesn't make a difference because if you smoke, obviously you're going to have a bad effects of that. So just keep in mind, if you're smoking, just go for your regular dental visits. Make sure you're having the proper oral hygiene at home. And make sure to check, like my friend discussed about the oral lesions. So make sure at home every 2 to 3 weeks, just check any lesions, any susceptible lesion. If there's any lesion, just go for your dentist. And now I'm going to pass to Sarah.
Holding.
Okay, thanks, Himani. So I'm next going to talk about dental caries. So I know myself, I've had what we call a cavity before once in our lifetime. With smoking though, the chances of getting cavities are much higher due to the fact that with smoking, it does reduce our saliva production in our mouth. Having saliva in our mouth is a very good thing. It helps stimulate the gums, it helps wash away any bacteria, neutralize any acids in our mouth from eating or drinking certain things. But with smoking, when I eat or chew something or when I drink certain things, that could be an early indication of a cavity. Mouthwash, or we can use a saliva substitute that can be a lozenge, kind of like a candy, but it stimulates the saliva production in our mouth. So if you happen to notice that, hey, I think I may be a candidate for dry mouth, feel free to come up to one of us and we can guide you in the right direction into recommending a product for you guys into aid of fixing your dry mouth. So just, I guess the main point of with the cigarette smoking and your oral health is that it's a big indication or you're at a higher risk for dry mouth. And with dry mouth, that you just have a higher chance of developing these cavities, as well as periodontal disease, of which Himani just had mentioned to you guys. So I'm next going to pass it over to Lovepreet, and she's going to talk about the next topic.
Hello everyone. So I'm Lovepreet. So I'll be talking about dry mouth. Although Sarah touched on it, but I'll be going like a little bit in detail about it. So dry mouth, we call it xerostomia in medical terminology. It's dry mouth. Basically, there is less production of saliva in your mouth. So it can happen because of multiple reasons. The main reason, like as we are talking about smoking, so what happens is the chemicals and the heat which is released when you smoke, it damages your salivary glands. The glands which are responsible for releasing saliva, the glands which produce saliva, they are damaged, and the ducts, the kind of like the openings through which the saliva comes out, they are destroyed, and that leads to dry mouth. Other reasons which are responsible for dry mouth are the medications which we usually take. Antihypertensive medications you take for blood pressure, the medications you take for like antidepressants you are taking, or anti-anxiety, or even the allergy medications you are taking, they even cause dry mouth. So there can be like multiple reasons you have dry mouth. And the main reason, as I said, is like smoking, which destroys your glands. So as Sarah already touched on it, like it's a very main cause of like your tooth cavities which we get, and other than that, it can lead to fungal infections in our mouth. It's like white curd-like lesions which you see in your mouth. They can happen because of the dry mouth. And then what other symptoms you can see, which can like give you an idea, like maybe you have like less saliva production, is like your lips are dry all the time, your mouth is dry all the time, and then it can even affect your voice. You can have like changed voice, and you can have a bad breath. So that also like can happen because of less saliva production in your mouth. And periodontal diseases like the gum diseases, they can occur because of the dry mouth. So there are multiple symptoms which you can like maybe like detect on yourself, and then you can go see a dentist if you feel like that like there is something wrong. Like, and then how can you fix dry mouth? So there are multiple things to fix dry mouth which you can do on your own. So maybe like sucking on ice chips. Like if you have dry mouth, you can suck on ice chips, or try to like drink a lot of water and try to like take smaller sips of water like all the time. And then there are lozenges. They are like chewing gums. They are sugar-free gums, so they don't add on to your basically they don't affect your blood glucose level. So they are sugar-free gums. You can always get those. And there are sugar-free candies you can get. They are also for dry mouth. And then there are certain mouth washes. Like Biotene is one of them. I think you can get it over the counter as well. So they are mouthwashes which help you in relieving the dry mouth condition. And maybe like try using like lip balms and stuff. They can help relieving your dry lips. And try to drink as much water you can, so that can also help reduce it. And try to cut down, if you're smoking, try to cut down on your smoking, because it's kind of like, you can say it's kind of like a sign, like it's affecting your oral health. So yeah, dry mouth is like a very significant sign, so you should not ignore it. It can indicate like many things, like they are going to, behind the scene. So yeah, other than that, Afrin, she is going to kind of like conclude the topic.
Please give a good clap and encourage the students. We are very happy to receive you in our senior club. I am sorry that we were in a conference. I was a little bit late. My name is Dr. Sabharwal and I am the president. Here is our senior club. You all are most welcome, and how beautifully you have explained. Really, it is highly, we all should applaud it, you know. Whenever any student speaks, thereafter there must be good applause. Thank you very much. Continue.
Okay, my name is Afrin and I'm going to talk about nicotine stomatitis. So before going into this topic, this is not a very serious topic, you guys should not worry, because if somebody is smoking, that person can get back to normal. Okay, so it's not that scary. So how many of you smoke?
None of us.
None of us. Oh, okay, that's a good thing. Okay, so how is this all going to help you guys? Like your grandkids, your kids, your neighbors. So it is for the community. That's what we are here for the community. You guys should learn. You don't smoke, but you can educate other people. And the sources like us explaining you guys. So nicotine stomatitis, happens on the palate. Do you guys know palate? Like the roof of your mouth. So when you open, if somebody is smoking, and when you open and you see, they might have, who are chronic smokers, who smoke regularly, like 10 cigarettes per day or 20 cigarettes, one back to back, like they get a hole. So it's not a hole, that's how we say. So you might see like a dot, like you take a red pen and you put a dot and circle around it. So it might look like a dot on your palate, on the back. And if some person is wearing a denture, or something partial denture. So even if when they are smoking, this can happen at the back of it. So whatever it is covering at the back, you will see that spots. And why it causes it? Because when you smoke, there is a lot of heat going inside. And our tissues, they are very delicate. So you need to be very careful. Like when the heat goes, it causes heat sensation and it causes pinpoint red spots on it. And it is called smoker's palate. And but there is a good news for it. You should educate everyone that there's a good news. It's happening. It can get worse, but if your willpower is strong, just try quitting smoking. In 2 weeks, you will see the result that once you stop the heat going inside your body, through your throat, it will go away. It fades out, and eventually you will have a normal palate. So nicotine stomatitis. So everyone will remember. So the name comes nicotine. Nicotine is the product which is present inside the smoking thing. Like either you're a pipe smoker or a cigarette smoker, nicotine is a substance which is present. Stoma. Stoma is the mucus. So mucus lining of your throat. It's a soft tissue. So stoma. Titis. Titis is inflammation. Inflammation of that. So I hope you guys are clear. Yeah. Can somebody tell me what does nicotine stomatitis mean? Stomatitis, stoma, lining, the oral mucosa. Itis is inflammation.
Inflammation of the oral mucosa.
Yes, perfect. Thank you. So the next group, 2B, is going to present.
You guys all done? Tell us that you guys all done?
Yeah, we just have a handout to pass around after for everyone to take home. And it just gives you exactly what to look for in your mouth for screening yourself at home and the step-by-step instructions to do it. So we will leave those with you after.
Thank you very much. So this is Sarah's group. The presentation is done by Sarah group.
Very good, very good, wonderful.
That was Sarah's group. We talk about
ये चमन हमारा अपना है, ये चमन हमारा अपना है, इस देश पे अपना राज है।
Yes, this was Sarah's group, and now we are having another group, and this was very beautiful presentation by all the students, and really, when I was hearing it, many new things I learned from their
that's really helpful.
speech.
Actually, it's not right.
And,
they talk about oral health, now they're going to talk about diabetes.
Diabetes, I think 90% of the people they are suffering from diabetes, and for them this is very, very important, and they should learn something from them. Thank you very much.
All right. Hello, everyone. Thanks for having us. We have Rachel in the back. She's just handing around some paddle boards. We have a game at the end. You can see on them one side's a T and one side is an F, and that's for true and false. So pay attention to our presentation because we'll have a little game. My name is Danica. Like the other group said, we're from the Cadh Academy of Dental Hygiene. We're dental hygiene students. We're graduating in almost a month, so near the end. Woohoo! And my group here is going to talk about diabetes, and I'll give it to Almira here to kick us off.
Thank you, Danica. So, good afternoon, everyone. So, I'm going to start us off with a question. I think you guys already know what I'm going to ask. So, who in here has diabetes? Or you know anyone with diabetes?
It's easier to ask who does not. Everybody has.
Right, okay. Thank you. Yeah, true. Thank you. That's true.
And you in India here, laddus and jalebis, they said.
They think that they eat sugar.
Sugary
Oh,
sweets.
right. No, we all do, right? We love sugar. We love
That's a cereal candy.
You can eat that all day.
They have a sugar fix, right? That's why we can laugh so much then.
Well, thank you. That's good to know. And now, so most of you already know what is diabetes. It is a condition where the body can't produce or use insulin effectively. The role of insulin is to control blood sugar levels. According to Canadian Diabetes Association, 11 million Canadians are living with diabetes or pre-diabetes, including seniors. So there are 4 types of diabetes. There is pre-diabetes, type 1, type 2, and gestational diabetes, but that's only temporary and occurs during pregnancy. So first, I'm going to talk about pre-diabetes. So it is a condition where blood sugar levels are elevated, but not yet at the threshold for type 2 diabetes diagnosis. Not everyone with pre-diabetes will progress into type 2 diabetes, but many do. And that's why awareness and proactive management are important. And the type 1 diabetes. It is an autoimmune disease. Individuals with type 1 diabetes require insulin injections. The typical onset is in childhood or adolescence. And roughly 10% of people living with diabetes type 1 have type 1 insulin-dependent diabetes. And then type 2 diabetes is insulin resistance or inadequate insulin production. Prevalence among adults, including seniors. Roughly 90%, like what doctor said, people living with diabetes have type 2 diabetes. That's why early detection and management are important. And this is just blood sugar levels to know if you have diabetes. So if you guys know your sugar levels, just watch out. If you have diabetes, you will have 7 millimoles per liter or less than 146 milligrams per deciliter. Yeah. So just watch out for the number 7. If you have higher than that, then you probably have diabetes. So if you think or you know someone have diabetes type 2, please speak to a doctor or a healthcare provider. Thank you, and I'm going to pass it to David.
Hello everyone, my name is Bhumika and I'm a dental hygiene student, and thank you so much for listening to us.
So before giving you the link between diabetes and our periodontal tissue, I just wanted to explain you what are the diseases, like what are the periodontal diseases related to that. So periodontal diseases mean that is a technical term for the dental professional. For you, it is like the diseases related to our mouth, like the gum disease related to teeth. So how they are affecting us. So that we usually tell everyone why we need to brush. What is the importance of brushing regularly? So we tell that you should brush 2 times a day, morning, evening. So why we are brushing? So whenever we are eating something and then we are sleeping and waking up, there is a layer on our teeth. So whenever we brush, we clean that layer. So there are some layers which can't be removed with the brushing. So that is why we tell everyone to go for cleaning regularly. So when the person is not going for cleaning regularly and not even brushing regularly, so there are some layers on our teeth which is creating inflammation, like they're swelling our gum. So when there is a swelling, the term is like gingivitis. That means our gums are swelled. That thing we can reverse. When you go to a dentist, a dental hygiene, they can clean and we can reverse that thing. But even if there is an inflammation and bleeding for gums, you're still waiting. You're not going to a dentist for a checkup. Then what's happening is that disease is going down. It is creating more problem in your teeth. Like we have bone in our teeth, like we have teeth, then gums, and we have a bone. So when we are not going for cleaning and there is an inflammation, bleeding, everything is still there. So what it is doing is, it is affecting our bone. It is going inside our bone, and that term is like periodontitis. That term is like technical term for us, but that means it is destructing our bone. So that thing is not reversible. We can maintain it, but we can't reverse it. So when you go on that stage, we can clean your teeth, but the bone is already destructed. So that is why we always tell everyone, if you see there is a swelling, there is bleeding coming from your gum, you should go for cleaning. Because when we are brushing, we know we all brush, but we are not doing properly, right? Sometimes we are just doing for 1 minute, quickly, like we have to go somewhere. So that is why whenever you're going for cleaning, the thing which we can't remove with brush, the professionals are cleaning for you. So these are the 2 terms like gingivitis, the disease which can be reversible, and periodontitis, when there is a bone destruction, we can do cleaning, but we can maintain. We can't reverse that thing. So now I will give it to
My name is Tina. Now that we kind of touched on a little bit about gum disease and diabetes, I'm just going to explain a little bit of the link between the 2 and how they work with each other. So essentially there's a 2-way street between gum disease and diabetes. So the severity of one affects the other and vice versa. So the main commonality between the 2 is the control of glucose levels. So we know that glucose is directly related, or glucose levels are directly related to diabetes, but they are also related to gum disease as well. So when, let's say we're diabetic and we're not fully controlling our diabetes, we're not taking medications as prescribed or insulin or whatnot, our blood glucose levels are increasing, and in turn they're increasing in our mouth as well. So how that kind of relates is that when we're diabetic and we're not controlling our diabetes, it narrows our blood vessels, so it's making it harder for our blood to filter out any waste or bad bacteria that can potentially harm our oral cavity. So that in turn causes inflammation. So we want to make sure that we are controlling our diabetes so that we can control our gum health as well. But on the other side, if we have gum disease and we're not controlling that, so we're not taking care of our teeth, we're not brushing regularly, we're not keeping up with our regularly scheduled dental visits, and we're not keeping up with our oral health, that the bacteria in our mouth can also travel through our blood as well. It elevates glucose levels and in turn makes the diabetes worse as well. So yeah, we want to make sure that we we are controlling our diabetes, but we are also maintaining our oral health as well, because one directly affects the other.
I'm Lydia, and I will be explaining about how to prevent periodontal disease. As Lydia and Tina, they have already explained what is periodontal disease and how it affects the body, like especially when you're diabetic. So let me explain how we can prevent periodontitis. So how many of you experience bleeding while brushing? Have you ever noticed? Yeah. So bleeding while brushing, it's a first sign of periodontitis. Periodontitis means like inflammation of the gums, like gum diseases. So when you experience bleeding on brushing, the first thing you have to do is that you have to concentrate more on your oral hygiene. So you have to make sure that you are going to a dentist regularly and get the dental checkup done as soon as possible. So, and also maintaining a proper oral hygiene is also very important. So you have to brush twice daily for 2 minutes, and you have to use the fluoride containing toothpaste, and make sure that you are flossing every day. So how many of you floss every day? Yeah. Good job. Yeah. So you should practice flossing every day. So some people may experience difficulty when they start flossing using the threads, the floss threads, the thread-like thing. It's called the floss. So if you are experiencing difficulty, you can use some other interdental aids like floss picks, floss picks, or some sort of interdental aids, And also the most important thing you have to do is make sure that your diabetes is controlled. So if you have diabetes, make sure that you are not eating a lot of jalebis and ladoos, and make sure that you are including like fruits and vegetables in your diet. Go for exercises. So like that, we will be able to control the periodontal diseases and also diabetes. Very good. So, Anita will be continuing.
Awesome. Okay, so we've talked a little bit about diabetes, periodontal disease, or gum disease, and how they're related and how we can prevent gum disease. Next, I'm going to talk about how diabetes can also be linked to other conditions in the mouth, okay? So the last group talked a little bit about dry mouth. I'll talk about it again. The fancy word that we call it is xerostomia. But dry mouth is affected by decreased salivary flow, okay? When you have diabetes, you might notice that you're going to the bathroom a little bit more often, your oral tissues are a little bit more dry, and that can cause your mouth to harbor more bacteria and bad bacteria, okay? So that bad bacteria can cause gum disease and can also cause cavities in the mouth too. Like the last group was mentioning. And how we can control that is by using salivary substitutes. So you can use Biotine, that's like a spray or a mouth rinse that you can buy. There's also a lozenge called xylitol, and that helps prevent against cavities and it helps stimulate salivary flow, which is great. And then sucking on ice cubes and making sure that we're drinking lots of water. With dry mouth too, you might notice that your tissues in your mouth are really dry and they start to look a little bit wrinkled. In those wrinkles, it's really hard to get food out of there, okay? So sometimes you can get bad breath because it's hard to clean. So just making sure that we're really using our toothbrush, using our tongue cleaner, and getting all those nooks and crannies just to make sure that our mouth is super clean. Next, we'll talk about a fungal infection. So it's called candidiasis. It's caused by Candida albicans, and it's normally found in the oral cavity and other areas of the body, just living happily, not causing any issues. But once you have diabetes, your immune system is altered. You don't have as great of an immune system as other people. So that fungal that's usually there all the time can start to cause an infection. Now this infection can come as many different types. So you can look in the mouth and you might find some white spotting on your cheeks or your tongue. It kind of looks like cottage cheese. Or it can also come up as a red area on the middle of your tongue or even on the corners of your mouth. And that is a sign that you might have a fungal infection. If this ever happens, if you take a look at your mouth and you're noticing something's not quite right, go to your doctor, talk to a dentist, anything like that. They might prescribe you some antifungal creams or medication that can help prevent that. And then talking a little bit about cavities. So cavities can happen all over the mouth. But as we age, we might notice that we're getting a little bit of gut recession. Those areas of recession are more prone to cavities because you don't have enamel on your root surface, okay? So that layer that's there instead of enamel is much weaker and more susceptible to cavities. And when you don't have as much salivary flow, your saliva is not cleansing the area as much as it should be, so those areas are really high chance of getting cavities. And a solution to that, again, is just making sure that we're having saliva flow, so sucking on ice cubes, using biotin and xylitol, and drinking lots of water. In addition, we should be using a fluoride mouth rinse, Listerine, anything like that, and toothpaste as well with fluoride in it. And two, when you have diabetes, especially if it's not controlled really well, you might notice that your breath smells like fruit. I don't know if anyone's experienced that, but it's called a fruity breath, and that just means that your blood glucose level is very high, and your breath is starting to mimic that high sugar content that you have in your blood, okay? So that is a sign that it's not controlled properly, and you should be going to your doctor just to take care of your blood pressure, maybe increasing your insulin levels or increasing the medication that you're on. And then last one that I'll also talk about is altered taste. So maybe you have a favorite food that you're starting to eat now and it tastes a little funky than it used to. It might be just because that your mouth is a little different now that you have diabetes. So again, your salivary.
Yeah, so any types of products that can be used similarly to tobacco products like betel nut, chewing tobacco, vaping, any of these things, using hookahs, these all put people more at risk for developing oral conditions that we talked about. And smoking alone doesn't only cause oral cancers, they can be caused for many number of reasons. So even though nobody in our group here smokes, it's still important that you're screening yourself at home.
Any more questions? You guys did a good job. You learned everything.
Yes, nice presentation. Harshini has come, your coordinator? No. Convey my regards, and definitely it was a pleasure to have you with us. And listen, that you told us a number of things about which we are not aware of. We shall take care. And when you were talking about that, how many people they smoke, actually I have left smoking, but there was a time I was a chain smoker. I always stayed, we relish, we enjoy, we relish. And yes, and we relish with laddu jalebi. And every time there is a demand in this club that आज हमारे यहाँ ना लड्डू जरूर लेके आइए, जलेबी जरूर आनी चाहिए. So anyway, listen, samosa, laddu, jalebi, no more in this club. Anyway, we are highly thankful to you, and we invited you on 17th also. But incidentally, what happened that on 17th we are celebrating Mother's Day. We have this hall and the other hall, so that way we shifted it to 22nd. We took a decision at a very late stage, so I requested Harshini Ramesha to change it to 22nd. So please come on that day. And then on 31st also, some of your students, they are coming. You are most welcome whenever you feel like. Ask your coordinator to send us your name so that we can give you certificates also from our class. Application certificate will be given. Thank you very much. So let's stay for a cup of tea.
ये चमन हमारा अपना है, ये चमन हमारा अपना है, इस देश पे अपना राज है, इस देश पे अपना राज है. मत कहो कि सर पे तो